Hello, hi, my name is Jennifer, and I'm going to be completing a head-to-toe assessment on my patient. This is Sheena. Sheena is 18 years old. Sheena, do you give me consent to start this assessment?
Yes, I do.
Thank you. I am first going to start off by inspecting Sheena. Sheena appears well dressed. She is in no sign of distress. Her skin is appropriate to her ethnicity. I am then going to assess Sheena's head and scalp. Sheena's head is symmetric. Her scalp, I'm palpating it. Her scalp, there's no lumps, no lesions. Her hair is evenly distributed. There's no signs of female hair loss patterns. I am now going to assess Sheena's eyebrows. Sheena's eyebrows are, her hair is evenly distributed. Her eyelashes are intact. Her lashes are intact. I'm now going to start my eye exam as well. Her sclera and conjunctiva are also clear, intact. There's no drainage. There's no crust to her eye. Her leucoma is also, there's no edema, no swelling. I am now going to assess her pupils. Sheena, I'm just going to have you look straight ahead. Her pupils are equal, round, and reactive to light. I'm now going to check for a combination. Sheena, can you look straight ahead? Sheena's pupils restrict when the object gets closer to her. I am now going to assess Sheena's nose. The outside of her nose is symmetric. There are no lumps, no lesion. Sheena, would you mind tilting your head up? I'm now going to check inside of Sheena's nares. There's no deviation to her septum. Her nares there's no redness, no bogginess. It's appropriate, pink and moist. I'm now going to assess Sheena's mouth. Her lips are intact. There's no crack. It's moist. Sheena, do you mind sticking your tongue out for me? 1 second. Stick your tongue out and say ah. Okay, there's no redness to her pharynx. Her tonsils are a +2. There's no redness or exudate. Her uvula moves up and down as Sheena says as Sheena sticks her tongue out. There is no, her teeth are intact. There's no sign of poor dental hygiene. Her mucosa is also intact, it's moist. Her saliva is moist. There's no lesions or open areas in her mouth. I am now going to assess Sheena's frontal and maxillary sinuses. Sheena, if you feel any tenderness, please let me know. I'm assessing her maxillary area. I'm also assessing her frontal. Did you feel any tenderness at any point, Sheena?
No.
Okay, I am now going to assess Sheena's sinuses. I'm assessing her tonsillar. At any point, please let me know if you have any tenderness. I'm assessing her tonsillars, her submandibular, her mandibular, her occipital, her preoculary, her postoculary, her superficial cervicular nodes, her posterior nodes, and the deep cervical chain. As well as this area, I would have assessed her subclavicle nodes. Sheena, did you feel any tenderness?
No.
No tenderness were felt. It is expected for some nodes to be palpable. If they are, they're supposed to be they're supposed to be non-tender. They're supposed to roll in both directions. I am now going to assess Sheena's ears. Looking at both ears, on the outside, it is intact. Her tragus, this area, do you feel any pain?
No.
There's no tenderness. I'm also going to check the mastoid. Do you feel any tenderness?
No.
There's no tenderness to that area. I'm now going to check Sheena's right ear. I'm going to pull up since she is an adult. I am assessing her tympanic membrane, which is pearly gray. It's intact, no signs of effusion. The cone of light is at 5. Her external canal, there's no sign of inflammation. The outer ear is also intact, no sign of inflammation. I will also do the same on the other side. The left side is the same. It is pearly gray. Cone of light is at 7. There's no signs of inflammation, redness, or effusion. Sheena, do you mind sitting a little to the center, please? I'm just going to move the camera a little bit. Okay, now I'm going to move down to check Sheena's trachea, as well as her carotid arteries, as well as her trachea as well. I am going to assess the trachea at the sternal notch, which is midline. I am also going to palpate from the back to check for any nodules, any goiter. I'm going to one at a time, press on one side at a time. Nothing, no goiter, no signs of nodules. Sheena, can you swallow for me? The trachea does move at it does move upwards. Now I'm going to assess Sheena's carotid arteries, as well as her JVD. Sheena, do you mind laying down for me, please? I am first going to auscultate Sheena's carotid arteries. This is done to prevent any dislodgement of any plaques. I am going to use the bell of my stethoscope to check. Sheena, can you hold your breath for me? I was able to check Sheena's carotid arteries by auscultation. There is no signs of bury. It is patent. Now I am going to auscultate both sides. Both carotid arteries are, there's no sign of turbulence. They're both patent. Now I'm going to assess Sheena's JVD. I'm going to put the ruler. First, Sheena is lying at a 30 to 45 degree angle. I'm also going to use a ruler at the angle, and then I'm going to use to measure at the point of venous pulsation. Sheena, do you mind turning to the right for me? When measured, it is lower than 3, which is expected, and that is normal. I would have done the same on the left side as well. Sheena, do you mind sitting up for me as well? And come a little closer. Would you turn to the side so I can, now I'm going to start with the respiratory exam. During the respiratory exam, Sheena's regular, there's no signs of respiratory distress, no signs of retraction. She appears to not be in labor. I am first going to palpate the 4 areas in the back. I'm going to check for tactile firmitus. Sheena, do you mind saying 99?
99.
It is equal. I am now going to check Sheena's chest expansion. Sheena, can you breathe out? Breathe in and out. My fingers move symmetrically. There is no sign of this unevenness. I am now going to palpate the front of her chest. Sheena, do you mind turning to the front? I'm going to do the same thing in 3 areas. Do you mind saying 99?
99.
No signs of tactile firmitus. I am now going to, can you do the same thing? Breathe in and out. It's symmetric. I am now going to percuss Sheena's back. Do you mind turning to the back again, sir, for me? I am going to percuss the 7 areas of the back. A healthy lung sound is renaissance. I am now going to check her diaphragmatic expansion. Sheena, can you breathe in? I'm going to find the area of dullness. Breathe in and hold. Okay. Breathe out and hold. Checking the area of dullness. This is about 3 centimeters apart. I am now going to auscultate Sheena's back for any signs of adventurous sounds. Take a deep breath. I was able to auscultate the 7 areas of Sheena's back. There was no adventurous sounds. Her lung sounds are clear. Sheena, I'm going to have you lay down so I can do your heart assessment. I'm inspecting Sheena's chest, the pericardium. There's no heaves or there's no signs of heaves. I'm also going to inspect the area. I'm also going to check for signs of thrills. There's no signs of thrills. Now I'm going to check Sheena's point of maximal impulse. This is located at the 5th intercostal space, mid-sternal area. Sheena, I'm going to have you, and I'm going to use the bell of my stethoscope to hear. Sheena, I'm going to have you turn to your side. Okay, you can lean back. This is also where I would hear the apical pulse, which I should listen to for a minute, and it should be regular rate between 60 to 100. I am now going to auscultate the areas of Sheena's cardiac, her chest for her cardiac rhythm. The aortic will be heard at the 2nd right interspace. The pulmonic will be heard at the 2nd left interspace. The herbs will be heard at the 3rd left interspace. The tricuspid will be heard either at the 4th or the 5th interspace. And then the mitral, which is also the apex, will be heard at the 5th midclavicular line. I am now going to auscultate with the diaphragm to listen to S1 high-pitched sounds, which are S1 and S2. I am now going to listen to, with my bell, to listen to low pitch sounds of S3 and S4. Sheena, can you sit up for me? At this point, I am also going to listen to her aortic area as well as her mitral area to listen to for any murmurs. I will do this with my bell for the aortic area. Lay back down, sorry. I did this already. Turn to the side. Okay, lean forward. I'm going to also do this for her apical area, her aortic area. Sheena, I'm going to have you lean forward. All set. I am now going to finish the rest of my respiratory exam by percussing the 6 areas of Sheena's chest. It should be heard with Renaissance at the top, with some dullness at the area of her heart as well as her liver. As I get lower, now I'm going to auscultate Sheena's sound, breath sounds in the front. Breath sounds were clear, no adventurous sounds. I'm also going to check for her any brachial sounds. There are no any bronchial signs. There's no stridor, which is significant for respiratory distress, since there was no abnormal brachiovesicular sounds heard out of place. I will not need to check for transmitted breath sounds, which would have been checked with a stethoscope, as the patient says E and 99 in the 7 areas in the back and the 6 areas in the front. I am now going to assess Sheena's peripheral vascular system. Before I do that, I'm going to check Sheena for any signs for capillary refill. Capillary refill is positive, is less than 3, which is a normal sign. I am now going to also check for skin turgor. By holding the skin and letting it go, there's no signs of skin turgor. Like I said, there's no signs of pallor, no signs of cyanosis. Her skin is appropriate to ethnicity. I am now going to continue with the peripheral exam by checking her radial pulse and her brachial pulse. This is a +2 on both. I would also do this on the left side and compare. I would also check her femoral pulses as well, which is located by her hip area. Right here is her popliteal pulses. I will also check for posterior tibia pulse and her dorsal pedis pulse, which are equal on both sides. Her there is no signs of edema. No signs of edema. Her hair on her legs are evenly distributed. There's no open areas. I will also go back to Sheena's eye exam, where with the fundoscope, I would have checked for the optic disc and retina using the negative diameter to check for the posterior, which would have been the optic disc, which should have been round, orangey color, and the vessels, which should have been intact. And I would have used a positive diameter to check for Sheena's interior area in her eyes. Thank you for watching me this exam. Thank you. Bye.